Well, that's a tough question to answer, but I'll do my best. It all starts with communication. I think, quite frankly, right now our healthcare system is extremely fragmented, and every element of the system, whether it's the people, whether it's the technology, whether it's those that have domain over reimbursement, legislation, you can go on and on and on. But the fact of the matter is oftentimes the left hand doesn't know what the right hand is doing. So it's really fundamentally important that we take a step back and re-engage and think about ways in which we can enhance our avenues of communication so that we can ultimately work better together to improve patient care delivery.
I think we probably need some legislation that will possibly regulate it a little bit better. We need a better communication and understanding about the goals for medicine in America, and somehow we need to have people looking at the same goals.
Well, I think we as pharmacy leaders, and I always worked with pharmaceutical companies and industry people who worked with us to help us improve our outcomes of our patients. So I think what ends up happening is the manufacturers, I think it's important for them also to start hiring people who really have experience in IDNs and working with the customers. It's one of the biggest needs that I find in talking to my friends and colleagues around the country that are in pharmacy leadership. And then, sit down with those individuals and start mapping out, what the future direction is.
I think a lot of that depends on what happens with the 340B program next month and what our friends in government decide to do with it. Other initiatives, there are a lot of questions about whatever healthcare bill is going to come through the government in the next few months, whether it's a complete breakdown or a change. A different aspect that we haven't had in the past. So we shifted more to a single payer environment, and I think that was highly successful. I think many more people are insured now than what were even 2, 3, 4 years ago. Do we continue in that fashion, or do we find a different way to pay? And that includes the people giving the care. We have to make sure that we have a seat at that table, and we're advocating for the patient. We're saying, yes, we know it's expensive. Yes, we know that you have costs too, but there's a patient at the end of this line. There's a bill that you're handing to that patient. It should be the high quality service that you promise.
I think we need to make some headway on our regulatory status changes for pharmacists to become providers.
So for pharmacy, I think we really need to get provider status throughout the country. We have pockets, a few states here and there have achieved that, but I think we really need a big push to get provider status for pharmacists nationally.
So I think one of the big things that I alluded to earlier in the interview is we need to continue to collaborating with other industries and leveraging their knowledge and their expertise as far as technology and analytics and artificial intelligence, so that we can get to a better point.
And measure value. What is value? An industry's measurement of value may not be what I feel our health system's definition of value is, and that's another crucial point when you're talking about pharmacoeconomics even, is that what's everybody's definition of value? There's so many definitions of value right now, and what you do with one IDN and their definition of value, you need to recognize may be different than another IDN's definition of value, and you need to be able to accommodate that.
I think there are multiple things. I mean, we need to train people on and explain what the pharmacoeconomics is, what this data analytics are, what is the data really telling you, kind of knowing the good data and the bad data, differentiating between the two, leveraging the technology that we have, utilizing it, maximizing it, optimizing it to the extent that we need it to be, and really getting the buy-in from all of our staff to get there.
Resources in pharmacy are certainly a challenge to get in the current landscape as we shift from the service-based model to the value-based model. And so the true answer of how we continue to evolve pharmacy practice, if we know we're not going to get additional resources or personnel, is we need to have our current resources and personnel being used maximally. So use of automation, use of technology, and really focusing in on our pharmacy technician roles and valuing that they play an integral role within pharmacy and utilizing them to practice at the top of their certifications, using technologies and using different efficient processes and workflow and lean processes that will really help deliver that care model with pharmacy.
So I think that's going to depend on where you're practicing. Different institutions are at different levels based on their leadership, their constraints, in some cases historically what has happened in the past 2 to 3 years. And again, that's where I look to ASHP to give us information on what's happening in the field. It's one of the big benefits of attending a session like mid-year. I think that for us personally, it's about looking at quality parameters and seeing where we can maintain quality while also containing cost. There are some cases where we truly want to improve quality, even if we have excellent metrics, because we're always striving to do the best that we can. But the reality is, we have to make sure that we're judicious in the way that we use our funding to take care of our patients.
We've got to be able to adapt. Nobody can stay stagnant in this market right now. We continue to succeed. We're being squeezed from every different direction from a cost savings perspective and a better utilization management perspective. And so we've got to be at the forefront of those changes. Especially as a pharmacist, I take it as a personal challenge to make sure that we're using our resources correctly, make sure that we're interacting with vendors, interacting with outside companies, looking at ways that other health systems have faced challenges and overcome them as well. Instead of trying to reinvent the wheel all the time, is what's been successful in other areas and other markets, and how can we use that within pharmacy to have some successes and share some success stories as well, and continue to grow and move forward in the right direction from a patient care perspective. So, I think the challenge to do that as a leader will continue to be there as we continue to go forward into the future, and that's a challenge that we look forward to facing and moving forward with going forward.
Well, I had this vision about 5 years ago of bringing together the innovators in technology development, electronic health records, automation vendors, with practitioners, almost like an expert panel, a think tank, to really look at the as-is and think outside the box. Because the as-is is siloed pieces, parts of how we manage things. So if it was up to me, I would say the Institute of Medicine, which is now called the Academy, brings together experts and evidence to make decisions about the future of healthcare. I think we need to do the same thing with automation technology. And I haven't seen a meeting of practitioners and the product innovators and the real stakeholders, including having nurses and physicians and pharmacists around the room, talk about what would the ideal state really look like given what we know is emerging in technology, with the technology developers know better than I do.
So when it comes to healthcare, I think 12 months is a very short period of time, and I don't know if that's enough time to have a meaningful and lasting impact. Usually a change in clinical practice takes over 10 years to be fully implemented, so with the rapidly evolving landscape in legislation, I really don't know in the next 12 months what will have a lasting, meaningful impact.